Hello, welcome to the website of Nutrition and Health Management, and welcome to the WWYP Approach in Patient Counseling. Socrates once said that it is more important to concentrate on the human who has the disease rather than concentrate on the disease within the human. True, health is a multifaceted entity, and this is how it really needs to be addressed. A multidisciplinary approach is fundamental for us for the WWYP approach, and addressing the human is key for our success. I have been counseling patients for more than 20 years now, and from the early steps of my career and from the very beginning when I started learning how to counsel patients, I realized that there was a serious communication gap between the health professionals and the patients that seriously affected their relationship as professional and patient, the treatment process, the follow-ups, the details of the diagnosis, and eventually the results. The issue, of course, acquires more seriousness when we're talking about chronic conditions and chronic disease. I have counseled people with chronic disease for many years, and I frequently see patients with chronic conditions, and usually what happens is that they reach a plateau. They feel that there's nothing more they can do. They feel that they've come to a dead end, and in a way they give up. And worse, sometimes they just give up to an extent where the condition deteriorates. For example, I've met many people who are struggling to manage their weight, and they're usually instructed on what tough regimen they need to follow, what is it that they have to do, but they're seldom lent a really listening ear as to where they stand in all of that. What is their opinion about things? What are their own goals? Or patients with diabetes. I have counseled many patients with diabetes, but very few of them were able to tell me in simple words, in their own words, what is diabetes? And yet they are required to collaborate with their health professionals in order to manage diabetes. So, are we really concentrating more on the disease and not the human? Wouldn't that give us a less accurate image of what is really happening? And how is that reflected in the results? I have seen that with many patients, with cancer patients, with cardiac patients, and more. The system of communication with patients and patient counseling seemed somewhat weak to me. And in my mind, after all those years, the solution was one: to create a new and better system in patient approach and patient counseling. And I did. Of course, this did not happen overnight. After many years of research, of further education, of participating in conferences, of having key roles in groups and associations that deal with the issue, and several years later, the new methodology was a reality, the WWYP approach. The WWYP approach stands for work with yourself, work with your patient. And the philosophy behind it is that healthcare professionals need to be trained. They need to receive specific training in patient counseling before they start assessing and counseling patients. The aspect of communication and behavior is imperative, and any weakness has inevitable costly results. Training workshops for professionals are available, and the WWYP approach is presented through talks for many years now, and a big effort is made to spread its word. The WWYP approach has been presented many times now in different scientific conferences. It has been in publications, and it was recently published in a scientific journal as an editorial. This is the approach that we use in counseling with our patients, and the results prove its continuous success and increased patient satisfaction.